Hi, welcome to the Skinner Response. I'm Nancy Skinner. Here we go again. Nothing like history repeats itself. This time, the debate about the cost of implementing health care reform, aka the Affordable Care Act. It reminds me, going back through my history books, of the struggle that we had to implement Social Security. Yes, the big bad evil program that took 50% of our elderly out of poverty, right? People don't remember. We don't have those people around to speak today. But the reason that FDR implemented Social Security was because we had a broken economic system. 50% of our elderly were in poverty, in tenements on the streets. And the simple idea of social insurance was that everyone would pay a little bit, and that the end is that seniors could be assured a good retirement. Well, what happened as a result? Republicans, including the head of the Manufacturers Association, testified in 1935 before the House Ways and Means Committee, James Emery, decrying that Social Security would be the end of our economic security in America, that why would President Roosevelt raise taxes at a time of recession? It was the worst possible thing that they could do, that he could do. Sound familiar? Well, what actually happened? And they had to do this. They had to get IRS agents, which I'm going to get to implement this, all those terrible things. And we took 50% of our elderly out of poverty. Those people had money to spend. Our economy came roaring back, and we became a superpower, because it's always when the middle class has money, when people have money to spend, business does better. When everybody's impoverished and we live with the very, very rich and the very, very poor, it's not a good economic situation. So let's jump to the Affordable Care Act and health care security. Today, everybody's going to be talking about, as I've talked about, the additional IRS agents that are having to be brought on board to enforce the provisions of the Affordable Care Act. And so the boogeyman are the IRS agents. Remember this, folks. That's the overhead. Those people will be making sure that the bums who can afford health care and aren't paying for it have to start paying for it. That's why the average premium for families has doubled over the last decade. To set their increase, the average family has increased their premiums $7,500. Okay, why is that? Because people who can afford it don't, and go to the emergency room and pass the buck to us, as well as the lack of accountability by insurance companies and by providers who just order endless tests and double tests, redundant tests, and have seen healthcare premiums. They don't care if they've doubled or tripled or risen by 40% in recent years. So now, with the implementation of the Health Care Accountability Act, insurance companies cannot raise their insurance rates by more than 10% without that plan being reviewed. They have to spend 80% of what they take in on actually delivering health care, and not major hundreds of million-dollar bonuses to their top executives, which is why we, the average American people, are paying so much for health care, why the health care system is broken, why our deficits projected outward to the future are unsustainable, and we've made a massive down payment with the Affordability Care Act in reducing our long-term deficit, in providing better quality care, because now each player in the healthcare matrix has a responsibility. They are accountable to make sure that they deliver the best care. If you end up back because they didn't deliver that care, they get penalized, not you, not the average American. These are the beat cops, these IRS agents, making sure that everybody is paying their fair share and that big companies are not ripping off America. Now, I think that's a good thing. I think history will think that's a great thing. And when people deride Obamacare right now, I will predict that the history books will say it was the equivalent of FDR bringing Social Security. How did we ever survive before it? Time will tell, but I can tell you that right now on the Skinner Response. Thanks a lot. Have a great day.